guys, welcome to part 2 of our episode with occupational therapist and SOS feeding specialist Stephen Kempler. If you haven't yet had a chance to listen to part 1, go ahead and listen to that first, and then hop on over here for more info. In part 1, we're going to talk all about what even is occupational therapy, what is feeding therapy, the role of sensory processing in feeding issues, as well as strategies for feeding challenges in infants and children, plus his personal journey to specializing in feeding therapy. So it's definitely worth a listen. Go on over there first. See you soon. So just to kind of make sure that we're getting a little bit more granular, let's say you're a parent at home and you're like, don't I need SOS feeding? Like, what would be like some very specific, like, if you're experiencing this, this is going to help. Like, what can families, come to you with? Like, what are the main problems?
There's a handful of things that I would say kind of fall in the, hey, we should maybe talk to our pediatrician, reach out to an occupational therapist. I will say, I always like there's some great pediatricians in town, such as yourself,
Thanks.
that are really good at pointing people in the right direction or helping tease out when those outside referrals are necessary. But one of the cool things I found in North Carolina is a lot of times you actually don't necessarily even need that first referral from the pediatrician to get into occupational therapy. And you can just come in for an evaluation and we can help, suss out what is the thing that's going to help this family become, or these children become, more successful. But some of those go-to things that I have seen that I would say require that higher need is the being stuck on those handful of foods where we're kind of in that cycle of eating those same things almost daily. And then this kind of goes hand in hand with this stuckness or rigidity is actually the dwindling repertoire of foods we're willing to eat. There is this idea I talk about. It's like there's this, and I think anyone could put themselves in the other person's shoes for this situation. If you ate the same 5 things 7 days a week, you're likely going to become very bored with those foods, and they're going to lose some value. And then next thing you know, our kid eats these 5 different things every day. Now they're down to 3. And then that is like, sends every parent's nervous system through the roof of like, oh my gosh, what am I going to do now? And then the other big one, of course, too, I think there is an appropriate amount of picky eating with kids, especially, I would say like 18 months to about 6 years old is like a very appropriate time to like be finding yourself basically. And like, it's kind of jumping through some of the higher stages of like cognitive development at that age range. And so the one thing to kind of look out for, though, is when we're really having these like really big emotional reactions to being exposed to these foods. There is definitely a piece where, it's one thing to be like, no, I don't want that. But if it's like full meltdown status, it's a pretty good indication, even if we are eating like even, slightly bigger repertoire of foods, like maybe in the 20-ish range or so. If that emotion piece is really big and powerful and disruptive to the, everyone in the household and to everyone's nervous systems, I still really recommend looking into a higher level of support, because those things really can start to become like habitual in the brain. And, we kind of get into these habits very easily, or carve out these pathways where that's just our go-to response when we're exposed to something we don't want to be exposed to. And so those, I would say, are kind of the 3 big things of, so the stuckness on foods, the dwindling amount of foods, and then that big emotion piece attached to it.
Yeah. I mean, that makes sense. Like when we're starting to wire our brains to a very rigid state and we're responding the same way, or maybe it's even escalating, and it's causing a lot of stress, and we're reducing the number of foods, which nutritionally may be problematic, probably is. You definitely do need to seek help. I agree. I think that's really good advice. And also great advice if you're sitting at home and you feel like maybe you're with a provider that's not hearing you or not as responsive as you'd like them to be, you can just go ahead and go and get an evaluation. So
Yes.
super important. Yeah.
I have run into the few of the, not in Asheville actually, but in other places, the wait and see approach. I am not always a big fan of.
Yeah.
And as you know, being kind of the nutritional guru that you are, we know that sure, like we can function off of these processed foods and fast foods and things like that. We can function. We are able to operate, but if we can get kids to a more ideal spot where they're eating a variety of whole foods and things like that, I think it can only help in our overall brain development, body development, cognitive development, all that good stuff.
Yeah, it's, this is kind of the root of functional medicine. It's nice that you use the word function because, there's getting up and going to school and doing your daily activities, and then there's optimal health. And it's like, What is that difference? And, I think it's interesting because we don't always think literally everything that we put in our mouth is what our literal body is made of. Like every cell, every nerve cell, every brain cell, every chemical and hormone. And so I think it's easy for parents to imagine, like if you are, out in a beautiful Lamborghini and you put fryer grease in that Lamborghini,
yes,
it may not run well. I don't know if it would even start. I'm not a car mechanic, but possibly, but it's certainly not going to run well. And same with our bodies, if we're putting fryer grease and not much else, the output and the function that we're going to get is not going to be super great.
Yeah.
So I just kind of wanted to, so like, let's say you're a parent and you have said, you know what, I need feeding therapy. I need SOS. They come to you and you're like, yes, I think you do too. We've done the full evaluation. So then, like, what happens in the therapy visit? So what does it look like when you work with the child and the caregivers? What can they expect?
Yeah. So, we really conduct a really thorough evaluation, and that helps give the occupational therapist the ability to start really developing like a set of goals and treatment planning for what's going to be successful. Depending on where you get the, your OT from, clinic-based, hospital-based even too. I know there's some great SOS feeding therapists that are based out of children's hospitals as well. The general look of it is we are going to have 5 to 7 foods in every feeding therapy session. Now, sometimes this is a combination of the practice providing, having a wide variety of foods available. In some of the smaller, private practices like I've been in before, I do have to talk to the parents and say hey, this isn't something we necessarily have available, and so I'm going to be asking you to bring a lunchbox of these things on to our appointments. And I always preface it is I don't need a ton. Quantity wise is not actually what's important when it comes to this SOS approach. It is the smallest amount. We talk about when I was still starting out with this, I was like, oh yeah, I want you to bring carrots and, et cetera, et cetera, et cetera. And this mom brought the whole bag of baby carrots with her to the appointment. And
she was ready. She was ready.
She was ready to go. It was amazing. But I was like, oh, actually, I should have been a little more specific. You only needed to bring 2 to 3 of those baby carrots with you. It really is when we are asking the parents to be the one to kind of help support with the actual foods bringing in, it is a smaller amount. And so, what we do with these 5 to 7 foods, we have a systematic approach with the SOS style that is called food chaining, which is basically the concept of connecting foods with whether it's color, shape, texture, or flavor. And this is kind of like the secret formula to helping kids bridge the gap into those non-preferred foods. And then part of that food chaining too, to help kids with this comfort level of getting to the point of getting closer to being exposed to new foods is having a combination of preferred foods, things they actually do eat all the time, semi-preferred foods, which I think most parents can find a couple things where they're like, yeah, like once a month or so, like if I present strawberries to them, yeah, they'll eat a few strawberries. And then those novel foods or outright non-preferred foods that we've had not so good experiences with. So every kid is different, so how we stack those 5 to 7 foods is really important, and it takes a really thought out process to say, okay, we're going to start with 2 preferred foods before we slip into a semi-preferred, and then maybe we're going to come back and end on a preferred food again to really help these kids. Now, and that is kind of the direct food that's getting involved in it, but there is so much education involved, not just for the parents, but for the kids as well. And so one of the things that we might be able to share on the screen here is what they call in the SOS world is the 32 steps of eating. And what this is a beautiful sensory hierarchy that starts with, as simple as like I said before, tolerating being in the same room as the food. I have worked with a lot of kids that I take the food out of the lunchbox and put it on the plate, and they are across the room hiding under a piece of furniture. So that tells me, hey, we are nowhere near close to getting that food up to the mouth. If we can't have a regulated nervous system with that food, just being on the table in front of us. Yeah. How could we ever get it to our mouth? And so we teach the kids about the 32 steps. I often have a printout of it and kind of gamify it a little bit as a fun challenge. It's like, oh, I wonder how far we can get with this food up our 32 steps of eating. And then really teaching and educating the parents about that as well, because if they accidentally try to introduce a food that's lower on those steps, there's a good chance we're going to have a big negative reaction to it that definitely can be held onto into their little brains. And, and I keep referring to little, but I've worked with quite a few teenagers as well, where, the same concepts apply. I will say with some of our older kids that we work with, I've even worked with a handful of kids that are transitioning to college, and they're like, hey, I've only survived off of pasta and pizza and chicken nuggets my whole life, and I don't want that to be me in college. So it's like, what can I do to get over this hump and not look like the weirdo at school or whatever it might be. And so we talk about the food science a lot too. So there's a big education piece of, how do we, I talk to kids and parents about is our tongue actually has to experience a flavor 10 times at least before we know it's a flavor we like or don't like. And I always reinforce this over and over again. It's okay if there's certain flavors and textures we don't like. All adults have things we don't like. I am very anti-pickle.
Okay, noted. I will not send pickles to your office as a gift.
I've tried it more than 10 times for sure, and it seems like a big flavor, and I don't really get how other people enjoy them as much as they do. With some of the adults I talk to, definitely not with the kids, but I do use the analogy of alcohol, because almost everyone can relate. Every adult can relate to the first time they've tried alcohol before, and it kind of being really overwhelming. And it's something that we oftentimes grow a taste for. And that's really how we have to think about things like vegetables and these other non-preferred foods, especially ones that have the more bitter profile, because our tongue actually doesn't naturally gravitate towards it, and it takes some building up in time. And so that education piece is highly important, talking about the science. And then there's a lot of psych involved as well, where just thinking about the language we use, especially for the adult side of things, and kind of starting to reframe how kids talk about food as well. We really get into the adjectives of food. And so if we're using adjectives that have a negative connotation to it, it's kind of setting us up for failure a little bit. And it's going to make it that much harder to bridge the gap if we're identifying a food as slimy versus wet. Just that simple shift. And then it's there's a lot of examples like that. What we talk about at the dinner table is really important as well. If it's a stressful conversation about work or school, we're already having a challenge that's going to take up some brain space. And then, also just adding to this piece of like the education piece, this is something I think a lot of people don't really realize, and we quickly get out of after we get out of the high chair stage of eating, is proper posture at the table.
Oh, so important.
And it's I think a lot of people frame that around as like, oh yeah, we want our kids to have good manners, but no, it's actually the example that we give is, have you ever been at a restaurant or a bar where you're at the high top table with those bar stool chairs and it doesn't have that little rung across it that you can support your feet on, and you're kind of shifting and moving around and trying to find that just right spot to like basically feel supported? A lot of times we do this fairly unconsciously and you don't even really notice you're doing this. It's taking up a lot of brain space to kind of get into a proper position. And when we're working on new things and hard things, we need as much of that capacity available. So the more things that we can like check off the list of like maximizing our availability is really, really important too. So we need to have a back on the chair. We need to have our feet supported. So many kids love sitting at the table with the family, but their feet are dangling. It's pretty uncomfortable. Yeah. Can we get a little stool? Can we stack up? I was going to say stack up some phone books, but that's an old concept nowadays.
We could stack up the phones.
There you go. There you go. Yes, exactly.
Yeah.
So yes, big. So the actual feeding therapy itself in the sessions is working through this hierarchy of foods and semi and non-preferred and preferred foods, and then so much education. And that combination is really the magic formula. And I always tell parents, we can gain a lot in the OT sessions, but it's those shifts at home that make the big difference.
We'll be right back after a short message from Dr. Ellie.
Your baby's birth should be a joyful experience, and with the right knowledge, it can be empowering too. If you don't know me, I'm a holistic pediatrician at Middle Path Peds in Asheville, North Carolina. In this free webinar that I'm so excited to share with you, you'll learn how to make informed choices about newborn care, from eye ointment to newborn screenings to when to give baby that very first bath. We'll also go over reducing environmental toxins and supporting your baby with whole food nutrition, all to give them the best possible start. You'll leave here feeling confident and informed and ready for those precious first moments. If you want to nurture your body for a healthy pregnancy, feel empowered in your newborn care choices, and learn holistic ways to support your baby's health, well, then this webinar is for you, and I invite you to join. Feel prepared, feel confident, and feel ready for your parenting journey. So click to join us for the free webinar.
And now back to the podcast.
Yeah, I love that there's 32 steps because I think it's really easy. And I find this like when I talk to parents also about toilet training, it's so easy to think of as a skill as like one thing. Because as an adult, you're like, yeah, you just like grab the food and you put it in your mouth, obviously, and chew it, or like sit on the potty and then go. And, you know, and it's not broken down. And I can imagine like a scenario where, you know, understandably, you're just like frustrated and now you're like chasing your kid through the house with a carrot and they're just like running away from you because they haven't like established, you know, any of those base steps. So we'll link that and then so you guys can see all of the steps because I think that is really important. And I do think like the psychology of the way that we talk about things around kids in general and not just with this topic is so key.
Absolutely.
And, you know, it's so easy to do because we may have grown up with certain ways of speaking or something's ingrained in us. And then it comes out in this way that could feel threatening or scary to a young child instead of like regrouping the way we talk about things in my work where people are choosing to vaccinate, I see it sometimes in that scenario where
Yeah,
it is just
absolutely.
built up. And by the time the kiddo gets there,
Absolutely.
and sometimes they have a meltdown anyway, but
Yes,
it's so
yes.
important to just kind of frame those concepts a little bit differently so that it doesn't feel so daunting to a kiddo. So, okay, let's kind of group together these two questions. So,
Okay.
one, what are the biggest misconceptions parents or even healthcare providers have about feeding challenges? And two, what would be some like just granular advice to give parents who are just frustrated and deflated at mealtime?
So there is a big list of misconceptions I can run through, but I'll give you kind of the big ones. I think one of them that we often kind of put out there is eating is easy. It's actually one of the most complex physical tasks humans engage in. Just for example, swallowing a piece of food requires 26 muscles and 6 cranial nerves just to coordinate one swallow. So that's just one little example. Um, this is a big one that I really teach to parents, especially grandparents. This is a harder one for our older generation. It's not appropriate to play with your food. It is so appropriate to play with your food. You think about babies, that is how they literally learn. They wear their food and this is giving their brain all this great information. And it's okay if our kids are a little bit older, if that's how it's going to get them to engage and be exposed to it, it is really okay and actually recommended. And that kind of what I had mentioned before, that wait and see approach is just not as ideal as we want. I get how some people get to that thought process. And there is a statistic that, about 50% of our picky eaters could grow out of this habit by around the age of 12 or so. But 50% is still a lot of kids. And what you were sharing, that optimal piece is like, if we want to try to get to this state of optimal function, why not try something like this a little bit sooner than later?
Yeah. And why, and it might be really stressful to wait from, let's say this started at age 2 to 12. I mean, that's 10 years. So, and I agree. I think it's challenging to relay as a healthcare provider because we do see so many kiddos with these challenges over and over and over again. I think our experience and our perspective and the lens that we see things is a little bit different because, when you see thousands of kids with the same kind of symptoms, you see the progression and you see over time, it may not really get better. And I think when you have a smaller perspective, maybe it's just 1-2 kids in the family. Maybe you don't even have extended family that has kids. It can be easy to kind of say, well, they'll probably grow out of it. And I see that with a lot of things. Speech is one of them where people are just really hopeful, and sensory issues, toileting issues that are going not in the way that we would prefer. And I think, to your point, the same with feeding.
To just add on to that other part of the question you said, my biggest thing that I would say to parents is you are so not alone. This is way more common than I think parents realize. And I definitely have noticed since I've kind of been in this world, there's a little bit lack of communication amongst parents. And whether that's like from a embarrassment or shame thing of not being like the best, parent you could be, or you're like, oh, I imagine everyone else does this easily. And it's like, I'm not going to bring it up at all, but I can almost guarantee you that if you have 10 friends, at least half of them are going through some kind of similar struggle that you are in the parenting world. And that's just across the board in general, not even specifically about feeding.
100%. I think about that a lot with breastfeeding because there's a lot of shame if someone isn't able. If you're not able to produce milk or you have a medical condition where you physically can't feed, there can be a lot of shame and pressure around that.
I always tell parents that I truly believe that they are doing the best they possibly can given their current situation and their knowledge that they have around it. And just simply the fact of like listening to this podcast today, talking to a friend or family member, seeking out professional help, doing a good old fashioned Google search shows that you are deeply caring and you want the best for your child, and you're putting in that work to be like, what could I be doing more differently? Doesn't mean that you're not a good parent by any means. And it's just sometimes we need a little extra help.
Yeah, I agree. I think parents are doing an amazing job, and in general,
Yeah.
so critical when
Yes.
99% of the time, just amazing people
Yep.
raising their kiddos. Let's leave people with a success story so that they
Oh,
can maybe feel empowered and ready to
absolutely.
take this on. Can you give us
Absolutely.
a story from your practice?
So, what I would say is that success is a funny thing. We often come to the table, both as parents and newer therapists, with these big expectations of like adding these like 20 foods that like are things the parents make for dinner. What I would like to challenge people with is this kind of reframing of what success actually means. And I can tell you, I have experienced a lot of success, especially when you look at it through this angle. So just establishing a mealtime with parents and children eating together in a stress-free environment, such an amazing success that I have seen over and over again. Gaining the ability, this is a big one, gaining the ability to go on like a vacation or out to a restaurant where you're not so stressed out as the parent that like, oh my God, there's not going to be anything that they could eat. What am I going to do if they have that meltdown in the restaurant? So gaining that ability to be able to go out, go on a trip and not stress about that, huge success that I've seen in a lot of kids I've worked with. Personal favorite, getting a child to high five me with a handful of applesauce in my hand. For someone that has a tactile sensitivity that would have a total meltdown and need to wipe their hands off or run to the bathroom as soon as they got a drop of something on their skin or hand. Huge success. And then frankly, to me, the biggest thing is having, kids have a lot of emotion tied into these eating challenges. So having a child arrive to one of my therapy appointments ready for food school with a smile on their face and excited to see what I have in store for them is such an awesome success within itself as well. So it's important to remember that, long-term goals can never be achieved without a lot of short-term goals being met first. So yes, I could sit here and tell you I have had kids go from 5 foods to 20 foods, but to me, it's really meeting those short-term goals is what feels the most meaningful to me. And I think if parents can try to reframe their focus a little bit on that short-term success too, it'll really feel empowering for themselves as well.
Oh, I love that. I love that so much, where it's more about like, what is that next little moment for your kid versus comparing to a kid that hasn't struggled with feeding or something like that.
Yes.
This is so amazing. Like, I really appreciate your expertise, your knowledge, your time. You're just a wealth of tips. There's so many more things I want to ask, like, how does this differ from an eating disorder? All of these things, but we have run out of time. So maybe we'll have to have you on again.
Yes.
I would love that. Yay. And so where can people find you?
And I'll say too, if you ever want to get into the sensory processing world in general, we could definitely spend another good hour easily about that as well. So, currently I am the lead occupational therapist at Whole Family Therapy. We're located just north of Asheville, North Carolina. You can check out our website at wholefamilytherapy.center. On our website, you can schedule a free consultation with us where you can just kind of tell us what's going on, and we'll give you our honest opinion of if we think the next step is scheduling an evaluation, coming in, meeting the therapist, or even referring you out to someone who we think might be the better professional that might support your child and your family. So I don't necessarily have any like professional social media accounts or anything like that. I'm a little behind the curve on that kind of stuff.
Coming soon.
But yes, I can tell you guys, where I'm at, and all the things I'm passionate about. But, I'm not alone in this occupational therapy world, and there is a lot of amazing OTs out there that have vast more knowledge and experience than me, or just starting out but hitting the ground running. And it is really worth exploring. And, if you feel like your children are having a challenge with this, to just inquire.
Amazing. You're such an amazing resource for Asheville. And I appreciate it so much. And I know I just want to vouch for you guys because I have referred to you before. I've met all of you, and you're just amazing therapists, and could not recommend more. So if parents, if you need it, whole family therapy. And if you need holistic pediatrics, 0 to 21, I'm here for you as well, in or around Asheville, North Carolina, or functional medicine ages 2 to 102, North Carolina, South Carolina, California, and is there one more? Probably Florida. All right, guys, wishing you well. Bye.
Bye, everyone.